Hello, my name is Tina Rodwell, and this is the first video in a series of 3 that is going to be explaining what activity means to a child with ME from a carer and parent's point of view. I have a son who's now 13, and he came down with myalgic encephalomyelitis when he was 8 years old. And the research has moved on from when he first became poorly. It is now showing that there's many problems within the patient's body. They include brain inflammation, systemic inflammation, low blood volume, immune system deficiency, abnormalities in the hypothalamic, adrenal and pituitary system, but most importantly of all, they have found abnormal gene reaction and energy metabolism in response to exercise, and this is called PEM. PEM stands for post-exertional malaise. Post-exertional, self-explanatory, you exert your body and you end up with a malaise. And a malaise is a general feeling of discomfort, illness or unease. Exact cause is difficult to identify. It is very often described as a flu-like symptoms with regards to ME. Malaise is an unfamiliar word, however, to parents like me, and it's very difficult for us to understand, and it can mean different things to different medical professions. The sticking point, I think, is the phrase exact cause is difficult to identify, which clearly in ME now that isn't the case. Science has proven post-exertional malaise, or PEM, is brought on by an exertion, and it always has really. PEM is a researcher's term, mostly of the medical profession's lack of understanding of what it means for the sufferer or for the carers that look after the people. It is the cardinal symptom or marker of ME, so it is astounding that children, when they're first diagnosed, the medical profession never look out for PEM or explain what it means to your child. Although it is noted in the NICE guidelines, it's something that gets pasted over. Nobody really sort of pays it any attention. So when the paediatric gave my son at the age of 8 cognitive behaviour therapy, which is like a passive aggressive way of changing your mindset from believing that these symptoms are doing your body harm, which they are, so that you gradually increase your activity, and they bolt on graded exercise therapy with the CBT, and that increases your activity in incremental bits, but they never look out for PEM, so therefore they can't gauge the harm that treatment is doing. And I was not informed this could have a detrimental effect on my son's ability and his health. So he went from about 70% ability to being bedbound within a few months. The person treating your child and gives you the diagnosis, whether it's chronic fatigue syndrome or post-viral fatigue or myalgic encephalomyelitis or ME/CFS, they should be able to explain to you what PEM is, what to look out for, and when to hold back from activity and give them more rest. If they don't explain that to you, I would be very cautious with the recommendations they give you, especially with regards to keep increasing activity levels. Even though the research points to harm if overstressing the body, this is often very dismissed by the medical profession. Again, stress means different things to different professionals. To psychiatrists and psychologists, that means anxiety or depression. To researchers, that means stressors put on the body in different forms. For instance, Ron Davis has found that if you give a saline solution to the cell of an ME patient, that cell goes under stress. As a parent, I wouldn't understand that from the beginning, and I don't think the psychologists or psychiatrists would understand that either. So we do have a difficult problem here with lack of communication and the words that they use. The National Health Service, even though we know that every stress that you put on your body can have a harmful effect, doesn't mention post-exertional malaise. So we can't blame the doctors for not understanding if they're not explained or educated of what this actually means. So doctors don't understand post-exertional malaise or PEM. They're not taught how to, and then they get frustrated because the cognitive behaviour or graded exercise therapy doesn't improve the patient, and then the patient is saying they're getting more symptoms. And because they don't understand this cycle that a patient goes through with post-exertional malaise, they then get very frustrated, and that causes conflict with the patient, the parent and the professional. I hope that explains post-exertional malaise. Thank you.